our second to the last speaker, Anshu Abhat, the Director of Digital Patient Engagement for Los Angeles County Department of Health Services. Anshu is also Assistant Professor of Medicine at UCLA David Geffen School of Medicine. In this presentation, Anshu will be challenging some of the preconceived notions that Tom talked about earlier about who benefits, what patients benefit from OpenNotes. Kind of an unspoken assumption that some have, that only patients with nice new computers on their desktops who speak English and are medically literate will benefit from OpenNotes. Anshu will discuss a different kind of culture change, but one that we think is equally important. On the last consortium call, I was the devil's advocate asking questions that some doctors have about OpenNotes to John Santa. Today, I get to be similarly playing the part of a skeptical doctor, and Anshu will help bust some myths about OpenNotes for vulnerable populations. So if we can go to the next slide. And I just wanted to say, Anshu, thank you for being here. Some patients on Medi-Cal, which is Medicaid in other states, who seek care in community health centers or safety net health systems do not have regular access to the internet. How could they benefit from Notes?
So, Carrie, I think one of the things that we have noticed, definitely when I walk around our ER or my clinic, is, well, everyone has a smartphone. And as I started to look at that more, we realized in our own literature that patients in the safety net are accessing the internet at similar rates as the rest of the population. And if you look at Pew Research, which does kind of regular market research for all of the US, there's actually this phenomenon called smartphone dependence. And we have patients who actually depend on their smartphone for any sort of internet access because we know when we pay those bills, cable internet is very expensive. We have patients also who are dependent on the portal and on their notes in other ways. So we have patients who are homeless who don't have access to mail, or we have patients who don't feel their mail is safe, so they can't get reminder letters safely, and they actually go to the library to access their notes and their appointments. So those are some key things that we've noted, this smartphone dependence and making sure that we are mobile first as we approach our patients. We also have looked at our local data in the Los Angeles Department of Health Services system, and OpenNotes views are on the rise. It's actually the fourth most popular feature after lab results, messaging, and patient education. So we are very proud of that. And for anyone who says, oh, patients in the safety net won't read their notes, I would like to tell you that is not true.
Excellent. Thank you. One myth busted. Not just safety net hospitals, but a lot of clinicians in California have a lot of Spanish or limited English proficiency patients. Can they benefit from OpenNotes, which are in English?
Yeah, so this is a very hot topic and a very good question and a very reasonable question. And it doesn't have a 100% clear answer, but we know some things around that. So we know in our lives, our family members and friends help us as we try to manage our own care or as we help manage the care of others. And of course, our patients have a very similar life experience. So we have found that a lot of our patients who are limited English proficient rely on other family members to help them through the health system. They may not have as good access to translation services, even in their regular encounters that they would like, so they need others to kind of help be interpreters. So we found a huge need for proxies. So caregivers like 30 to 40-year-old daughters and sons, I think more daughters, but they are often the proxies for their parents' accounts, and they can read notes, message providers, take care of things that need to be taken care of, and they may be at home taking care of their own families or at work and not always able to attend visits. So I have a Portuguese-speaking patient who I think her daughter was looking for parking, a problem that we have here at our health center, and she was actually able to read the note when she wasn't able to attend the visit, which was very helpful.
Great, thank you. We heard Tom talk about physician burnout, and I would guess that safety net providers are also crunched for time, especially in clinics with limited resources. Won't OpenNotes add even more tasks and time to these overwhelmed providers' workloads?
So I've now worked in 2 health systems that are safety net systems that use OpenNotes. One was Harborview Medical Center in Seattle, and the second is down here at Harbor UCLA. They're similar but different here in Los Angeles. And we know from the literature, but also honestly from our experience, that there is no change in the workload when we share notes. We've seen 0 change in workload both at Harborview and with our clinicians here at Harbor and the DHS system. What we do find it to be helpful is we know memory for oral conversations, especially when you throw in language and limited English proficiency, is not 100%. I think Tom might be able to tell us the number that it's closer to. I'm going to say I've seen things between 25 and 75%, but it's really not 100%. So it's really nice to have Cliff's notes for patients to review of the plans that we discuss. So I'm going to list the plan anyway. I'm going to write my plan anyway, but I also include smart phrases of links and apps that I want the patient to engage in. And that also saves time, because then I know that I don't have to do double duty on our after visit summary, because the way we do after visit summaries is different than other healthcare systems. So the clinician doesn't really interact with that. So I have put everything in one document that the patient can interact with. I had to write it anyway, and it actually saves me time to not have to double write in an after visit summary.
Okay, great. There's a lot of barriers to the doctor-patient relationship, EHR itself, where the doctor turns away from the patient to look at the computer, or scribes in the room who are taking notes for the provider. So won't OpenNotes create more cracks in the doctor-patient relationship?
So we know that vulnerable patients have concerns around trusting the system. They may have had bad experiences with health or other social services that's eroded that trust and kind of that dignity. And what we have found, and also the research has reflected, is that for patients with lower socioeconomic status, this actually creates trust. I have patients who have come to me and said, I don't want a doctor who won't interact with me online, where I can't read their information, because now that I've had it, I don't want to go back. And so I think there's a huge thing with trust. And we think of all the pills we give our patients for diabetes and high blood pressure. We have no pill to increase trust. And this has been major in the idea of transparency that can actually increase trust in a system that has its own inefficiencies and has its own resource limitations. But this is actually kind of a small thing we can do to improve our patient experience and engagement in care.
Great. Anshu, do you tell your own patients that they can access their notes? And if so, what is their response?
Yes, so I definitely tell patients they can access their notes because I tell them I want them to read my note, because a part of some of the additional links I have in there is for my patients to reaccess. And they are excited. When we go around also and talk with our patient family advisory councils, they are very excited that this is something that we're doing. Again, like was mentioned in the talk before, maybe we need to publicize even more. Yes, we've publicized on the portal. Yes, our clinicians are mostly aware of OpenNotes, unless they ignored my 100 emails. But we want to get even more engagement. And our research shows that if the provider is the one who's endorsing notes and portal, that the patient is much more likely to engage.
Okay, great. And our last question, have there been any problems in your organization due to OpenNotes? Any regrets, anything you've done differently, as Mike was talking about?
So we definitely had issues kind of getting up off the ground, I think, as anyone does, and we had to work through those issues. And we actually did have to work directly with our physicians union. So if there are organizations that are public organizations that would like to speak further offline, I'm very happy to do that. I definitely have spoken with some public organizations across the country about some of these things. But I think, there's always going to be a couple things that come up about, a clinician who has an experience with a patient who read a note. I will say that, we've been live for over a year, and we are live everywhere, inpatient, ER, and outpatient, basically 100% of notes unless they're marked as sensitive. So we have a huge rollout. and I have heard from 2 clinicians, and they were pretty minor issues. So it really hasn't been something that has been, it was like more problematic to think about it than to actually implement it, which was good. I think as far as things that I'd like to do differently, I think it's more of the evolution piece, and would love to hear from other organizations about this. We're really trying to create a champions program, both on the clinician side and on the patient side, even outside of our patient advisory councils. So those are things we'd really like to do to better understand how are people really interacting with the information that we've put online.
Great.
Awesome, thank you.